There's a call for a regional response to the surge of coronavirus cases. The discussion is turning to the importance of covering your face as mask orders take effect. KMBC 9's investigative reporter Matt Fleener explains how local leaders plan to stop the spread of COVID-19.
Tuesday morning, KMBC 9 News got access to a call of political and health leaders around the Kansas City metro. Their biggest point of conversation was about masks.
If I'm infected, my mask stops me from spreading that virus into the environment that I'm in.
Frank Thompson with Kansas City, Missouri's health department listened to a call coordinated by the Mid-America Regional Council Tuesday morning. With Kansas City, Missouri and Jackson County ordering masks in public places, along with the state of Kansas, on Tuesday morning's call, leaders on both sides of the state line talked about the change.
That it is not a huge leap for us to do this, but the advantages, the gains we can realize are tremendous. Such a simple measure among other simple measures like washing our hands, maintaining social distancing.
Almost half of our cases are either asymptomatic or pre-symptomatic. So that means the people that are walking around, they're actually spreading the virus through droplets that are getting expelled as they talk, as they cough, as they sneeze.
Thompson does say children under 3 should not wear masks. Between 3 and 10 is at the parent's discretion, and everyone above 10 should have one on to stop the spread of the disease. Health officials did agree as people get together for July 4th this weekend, masks are still very important if you're in those large groups. Matt Fleener, KMBC 9 News.
Kansas City, Missouri and Jackson County have implemented recent mask orders along with the state of Kansas. Platte County and Clay counties are not requiring masks. Here's the latest on coronavirus cases, deaths and positivity rates in our area. Missouri has now lost more than 1,000 people to the coronavirus. That's according to the latest numbers from the health department. In Kansas, the death toll is 270. Missouri Governor Mike Parson was asked if he would consider a statewide mask requirement like other states.
I do not plan to put an order in from the governor's office. Again, for people that live in those cities that want to live under those guidelines, that's their elected leaders' decisions. You know, I'm going to go back to what I said. Every day in this press briefing for I don't know how long, we tell you if you cannot keep the 6 feet in social distancing, to wear a mask. If you feel comfortable, wear a mask. I mean, again, everybody knows the situation out there. They know the risk categories right now that really a concern. I think you all got to, everybody has to keep that in mind and move forward.
Missouri is reporting 508 new cases since Monday. That's the highest number in 5 days. Kansas is only providing updates on Mondays, Wednesdays, and Fridays. Now, KMBC 9's Kelly Gibbs sat down with the doctor and the CEO of Truman Medical Centers to learn about how and when to wear masks.
Some circulating social media posts claim that masks are only intended for doctors dealing with patients battling COVID-19, that masks are ineffective for the general public. But health experts disagree.
We've come to find out that asymptomatic carriers are a significant component of why we have the spread that we have.
That's why Dr. Steele and others are recommending masks at all times while out in public, with few exceptions.
I would say outside it's not absolutely mandatory unless you're gathered together in groups and you're not able to practice clear social distancing.
While there are different levels of masks, Dr. Steele says even these, level 1, are effective at stopping the transmission of the virus from person to person if both parties are properly wearing them over both their nose and mouth.
Ultimately, what we're trying to do is get to a vaccine, and the hope is, by the 1st of January that we're in a position when we can do that.
Until then, these masks and 6 feet of social distance are some of the best strategies health experts recommend in the fight against the spread of coronavirus. In Kansas City, Kelly Gibbs, KMBC 9 News.
St. Luke's Health System says it will close the Cushing Hospital in Leavenworth on October 1st. Hospital officials blame the closure on increased costs of supplies to treat COVID patients and a loss of more traditional revenue sources. About 70 people could be affected. St. Luke says those employees will be able to apply for other positions in the health system.